So shifting gears on some of the environmental factors that can contribute to asthma, and allergies is one of the biggest ones. So when we see patients, particularly children with asthma, over 3/4 of them have allergies. And if they are exposed to those allergic triggers without identifying them or changing it, it's just going to set the kid up from having recurrent problems. Now, allergies can lead to seasonal variations in asthma, and depends on where you live. In Oklahoma, the late winter, we start seeing cedar pollen, so this can start coming out in January, February into March. It can lead to nasal symptoms and chest symptoms. It's particularly problematic in Texas and Oklahoma, and it can lead to what's termed cedar fever. It can be this robust inflammatory and allergic response. Then getting into the spring, there's numerous tree pollens that can lead to symptoms, including oak, pecan, mulberry, as well as several others. Once these pollens start going down, we start to see an increase in summer pollen. So this would include the grasses, timothy, fescue, Bermuda Johnson. Ragweed is in the fall. So you can imagine if patients with asthma are allergic to these things, numerous times of the year, this could be exacerbating or triggering their asthma. So getting a good handle of what they're allergic to can help us target therapy so we can at least reduce some of the allergic triggers. And then there's growing evidence that indoor allergens can play a significant role in asthma. I'm going to talk about a few of those. So dust mites, it's been known for a long time that dust mite allergy and exposure has a big impact on asthma. Dust mites are these microscopic creatures. They live off flakes of skin and they accumulate in the stuffing of pillows and mattresses. And when the patient is sleeping at night, they're respiring in these tiny particles that can lead to nasal symptoms and chest symptoms. And there's numerous studies that have documented that being allergic to dust mites can be associated with asthma. So this is just one I wanted to point out. It's an older study, but what they did is they went to patients' homes that had asthma, and they basically vacuumed up dust samples, and they measured it for this DERP1, or the amount of dust mite allergen in those dust samples. And they compared it to the baseline FEV1% predicted in these adult asthmatics. And interestingly, what they found is the higher level of dust mite exposure, the lower the baseline FEV1 was. And this really mirrors a lot of other studies that show similar findings. Some of the newer interesting studies also suggest that there's a lot of other indoor allergens besides dust mite. And some emerging data suggests that cockroach allergen is both common and clinically significant. And it also has been shown to be an independent risk factor for the development of asthma as well as asthma morbidity. And so the allergen itself is typically found in the feces, and there's been numerous studies that have shown how much exposure is needed for a person's immune system to generate an allergic response, meaning development of IgE leading to sensitization, and how much is required to cause asthma symptoms in those that are allergic. And again, this is an older study, but the main points I wanted to show was that they took inner city children with asthma and they looked at whether or not they were allergic to cockroaches based on skin testing, and then they measured how much cockroach allergen was in these homes. And what they found is in these green bars, these are asthmatic children that are allergic to cockroach, that have high levels of cockroach in the home, and those patients had higher number of hospitalizations and increased unscheduled medical visits. And so when we're thinking about some of our most difficult patients to treat, inner city children that with asthma, there may be multiple things that could be playing a role in being able to adequately control the asthma. There can be some cultural perceptions, which we already talked about, compliance issues, allergen exposure, which could also include cockroach. It's long been known that animal allergy can cause a problem. So patients that have pets in the home that are allergic to them, if they're going to be constantly sleeping with those animals, it's going to lead to problems. And cat allergen in particular is really small. It accumulates on clothing, it accumulates in the room, it remains airborne. So for patients that are allergic to cats, if the cat is anywhere in the home, there's going to be high levels of cat allergen everywhere. And both direct and indirect exposure to cat allergen can cause problems. And then contrary to popular belief, there's no hypoallergenic dog. So oftentimes our patients come in and say, I know that my kid is dog allergic, but we have a hypoallergenic dog. Some dogs have less allergen, but all of them have it. And so it's really important for us to understand that so we can tell our patients and guide them in the best ways to avoid these. And then another thing that's really common and it's important to keep in mind is that, particularly with cats, they can be members of the family, and it's going to be really difficult for us to convince parents and and families to get rid of the cat or limit exposure. And if we tell them, you're going to get rid of the cat and your kid's asthma is going to be miraculously better in a month, we're just setting themselves up to not believe what they told us. So this was a really interesting study where they took patients that had cats and they went into their homes and they collected dust samples like they did in the previous study where they vacuumed up dust, and they looked for the amount of cat allergen, and this is the measurement at baseline. And they went back, they got rid of the cats, and they went back at a period of time, they looked at how much allergen was still there in the home. And interestingly, it could take 20 weeks or more with the cat gone and cleaning to get the cat allergen levels to be equivalent to what would be seen in a non-cat home. And so for patients that have cat allergy that get rid of it, it can take weeks, if not months, before we notice any improvement. Now, shifting gears a little bit, mouse allergen exposure is also more common than we think, and it also is clinically significant. So this first came out of this National Cooperative Inner-City Asthma Study. And again, this was a study looking at more inner-city asthmatic children where they were looking at various parameters of the home environment. And in this study, they measured dust samples of how much of the mouse allergen was, how often they could find this mouse allergen in these dust samples. And almost 100%, over 95% of the homes had some detectable levels. Matsui et al. Then demonstrated that this mouse allergen could be seen in suburban homes as well. So this wasn't only seen in inner city homes. Our speaker next also did a study on this, and she reported looking at patients that had documented allergy by either skin testing or in vitro testing to mouse, and did nasal challenges. And the majority of those asthmatic patients that were mouse allergy positive did have symptoms. And so this really shows us that it probably is a clinical relevant sensitization. There's multiple other studies that have shown that mouse allergy is a risk factor for asthma morbidity in inner city children. And there's also studies looking at adults that have shown very similar findings. And so this is a particular one where they took adult women in Boston and they collected information about them in regards to asthma-related ER visits and composites of overall asthma morbidity. And those that were mouse allergy positive, the odds ratio for ER visits was higher, and the odds ratio for asthma morbidity, decreased asthma control was higher as well. Mold allergy can also be very problematic. And so mold can grow in wet, damp areas, but also in times of the year where it's dry, those spores can be sent out, and there can be some molds that have high levels in the air, even in dry times as well. So there's numerous studies that have also shown that mold allergy can play a role in asthma. Some of them include looking at Alternaria, Cladosporium, and Aspergillus, and some of the newer ones have really shown that there's been increased asthma exacerbations with exposure. And this led to the 2007 guidelines to start to make comments on controlling mold. And this would include proper building care, ventilation, and then humidifiers are something that a lot of our patients are using. And this just underscores the fact that we have to remember to remind our patients that if they have a humidifier and they leave water in there for days or weeks and they turn it on every night, there could be mold in that then you're aerosolizing. So it's going to be important that if our patients are using humidifiers to really make sure that we educate them on how to keep that safe. And then irritants. So allergies play a huge role. Irritant exposures can also play a really big role in both the development and the morbidity of asthma. So studies across the board in adults and children have showed that kids that are exposed to cigarette smoke have higher rates of asthma, and adults that smoke are going to have worsened asthma control. And so our patients know this, and so they're going to tell us they don't. And so we're going to have to figure out ways to sensitively ask them if they're smoking so we can make sure that they don't do that.